And now with one of the important issues in echocardiography, which is hypertrophic cardiomyopathy. Actually, it's very visible. Hypertrophic cardiomyopathy, you define it by the hypertrophy of interventricular septum, which is so much visible. As you see here, here is the interventricular septum and it's hypertrophied, as you can see. And now let's talk about the AortoPulmonary window. The AortoPulmonary window is best seen in the great vessel level in the parasternal short axis view. As you can see here, guided by the arrow, is the window or a bridge between the aorta and the pulmonary artery. The lesson today is the congenital heart disease. Now let's talk about some congenital heart disease such as here atrial septal defects. Atrial septal defects have so many kinds. One of them is called superior sinus venosus defect, which is near the superior vena cava, and the other one is the inferior sinus venosus defect, which is certainly near the inferior vena cava. One of them is the coronary sinus defect. You would see near the coronary sinus, and one is the fossa ovalis defect. You would see in the middle. It's either ostium primum fossa ovalis or ostium secundum. And now with the ventricular septal defect, as you can see, here is a defect between both ventricles that allows blood to pass from left to right, causing a left to right shunt. And here it goes the right ventricular dilatation. Ventricular septal defect, pulmonary stenosis, right ventricular hypertrophy, and overriding aorta equals tetralogy of Fallot. Here let's see it in echocardiography. Here is the ventricular septal defect between the right ventricle and the left ventricle. Here is the overriding of the aorta, and the pulmonary stenosis actually cannot be seen in this view, but the right ventricular hypertrophy is so much visible as you see here. Here is the right ventricular hypertrophy, and here is the right ventricular dilatation. Here is patent ductus arteriosus, as marked by the circle here. Patent ductus arteriosus is a normal connection that is present in the fetus between the arch of the aorta and the pulmonary artery. Actually, this shall be closed after birth. If it remains patent, it's considered a congenital anomaly, which is called PDA or patent ductus arteriosus. Here it is best seen in the suprasternal view, actually, like the coarctation of the aorta. Here, as you can see, is a bicuspid aortic valve. This is a congenital anomaly in which the aortic valve is formed of two cusps only, as marked here is the first cusp, here is the second cusp, there is no third cusp. Here is the quadricuspid aortic valve. The quadricuspid aortic valve is aortic valve which is composed of four cusps instead of right coronary, left coronary, and non-coronary only. Here another cusp is present, as marked here is the. Here is the coarctation of aorta. Coarctation of aorta is usually seen in suprasternal view. As you can see, here is the arch of the aorta, here is the descending aorta, here is the area of the coarctation between the arch of the aorta and the descending aorta. Here, if you throw a continuous wave, you will see the velocity of the aortic flow is more than 2, which means there is a coarctation or a narrow area according to Bernoulli equation.
Please like and subscribe to my channel.